Hi, my name is Mark Parkinson, and I'm the President and CEO of the American Healthcare Association and the National Center for Assisted Living. And I am very pleased to spend some time with you today here at the Signature Spirituality Fest. Now, I'm really glad to be participating in this for a whole variety of reasons. But one of them is a very small way to say thank you to Signature for being part of making 2014 a very good year for AHCA-NCAL. When I think back about the highlights and think about the highlights of 2014, one of them that really sticks out was the decision that Signature made to join its buildings in a significant number of states and to really become an active participant of AHCA-NCAL at the national level. I had the chance to work closely with Joe Stiers, with Diane Timmering, and with Kathy Gowan, who seems to be at every one of our political events. And the opportunity to work with those three folks and many of the other people throughout your organization has just been terrific. So thank you, Signature, and I'm glad to pay back in a small way by being involved in Spirituality Fest today. Now, there may be a bit of a problem here. I don't know if the same attendants, the same attendees were also at the Learning Fest back in the fall. I hope it's different people, and let me tell you why. I spoke at Learning Fest in the fall. It was the virtual activity that we had with speakers from all over the country for Signature. We had a slight hiccup back at AHCA where I was being taped because you weren't able to get the video of my presentation. You just got the slides, you didn't get the picture of me. So I started out by saying that I felt like you needed to have a visual of what I was all about, kind of what I look like, to help you kind of sit through the whole presentation. And so I described myself by saying that if you didn't know what I look like, just imagine George Clooney, and I looked exactly like George Clooney. Well, I'm hoping that there are different folks, because now you know that I don't look anything like George Clooney. This is me, this is what I look like, and so this is kind of what you're stuck with and what I'm stuck with. I think I probably did look a lot more like George Clooney last November, but we've had a really tough winter in DC, and it's kind of taken the life out of me here a little bit. It is fun to talk about spirituality, and I know it is a major pillar of the Signature organization and what you do every day. And before I get into the main part of my speech, let me just make a couple of comments about that. Stacy and me, my wife and I and our kids, our life's work was building, owning, and operating our facilities. I've had this incredible opportunity now for my 5th year to come back to DC and work with organizations all across the country. And one of the things that I've really learned in talking with these organizations and working with their people is what a strong theme of spirituality there is throughout our sector. Now, it's very obvious with many of the not-for-profits that are faith-based. Their very reason for existence is to further their religious missions. But what's really been exciting is I've seen that it's not just the not-for-profits. There are for-profit companies out there, and I think Signature would certainly be the leader, that have in a very demonstrable and vocal way made spirituality a major part of the organization. But it's not just Signature. I also see it in other members, some who talk about it and some who don't really talk about it, but they show it. As I get older and maybe hopefully a little bit wiser, I'm not really sure, words mean a lot less to me than actions. I think I've concluded that all the cliches that we learn when we're little kids really are true. And one of them is that actions speak stronger than words. And when I look at the actions of our members, I see spirituality through all of them. We come under criticism all the time from the press and from lawyers and the OIG and all that. But the truth of what is happening in our buildings is very spiritual. It's not necessarily people talking about spirituality, but it's people acting in very spiritual ways. I think the ultimate explanation of spirituality would be love, selflessness, giving, sharing, compassion, etc. And those things are happening in our buildings millions of times every day. Anytime that we hug a resident that's lonely, or console a resident that's not feeling well, or celebrate with a resident that's happy, anytime we dance with a resident who thought maybe they'd dance their last dance, or sing with a resident who thought they would never sing again, or provide therapy to folks so that they can get better and go home and just show our love, we are showing what spirituality is all about. It's that reason that I love the job that I have so much, that I am so completely convinced that it is important, that I know so clearly why we have to win in DC, because we're protecting what you and millions of others of people just like you are doing across the country, and not just talking about their spirituality, but in showing it. So in talking with Diane last week about what would be the best presentation for me to make, what we talked about was for me to give an overview, not get into the specifics of DC, but to really give an overview of what it is that we need to do to keep this great work going. And so in order to do that today, I'm going to first talk about some very general good news, some positive things out there that are happening, some of which you're aware of and some of which you may not be. Then I'm going to talk about the challenges that we face. It's not all rosy, and I get that. I'm going to talk a little bit about 5-star because that change has just happened so recently. And then we'll discuss what it is that Signature can do and is doing to make sure that it seizes the future. Seizes the future not just for the company, not just for you, the employees, but most important, seizes the future for the hundreds of thousands of residents that you will be taking care of over the next 10 or 20 years. So let me start out with some very high-level good news that you might not have considered. And that is that there are several trends out there that are quite positive that I think it's important to us to reflect on. The first is that we just made it through a horrible, horrible recession, and we're in pretty good shape. Now, as an adult, I've lived through 4 recessions. I thought the first 3 were pretty bad until this last one came along. This last recession was longer and deeper than anything the country has faced since the Great Depression. If you had told many people that this was going to occur, what they would have said to you about our sector is that, boy, that sector is in real trouble because margins are already razor thin, and if there's this enormous, huge recession, I don't think the sector will make it. Well, thank goodness that not only would they have been wrong, they would have been very wrong, because in fact, now that the data is out, the data reflects that we not only made it through standing, we actually did a lot better than a lot of other investment classes during this time. This next slide shows, first of all, as it relates to reimbursement. Yes, you can see there was a dramatic decline in reimbursement at the federal level in 2011. But before that and since then, we've been on a very slow, steady progression of modestly increased rates, both at the Medicaid level and at the Medicare level. This next chart, I think, is really encouraging. You know, if there are times that you wake up in the morning and you think, boy, I wonder why I ever got into this work, it's so hard. You know, the government's on us, the plaintiffs' lawyers are on us, the press is on us, and I don't see how we're going to make it. Well, in fact, despite all those pressures, we succeeded at a level that was greater than any other investment class during the Great Recession. This chart's a little busy, but basically that top line shows our long-term care sector, and it demonstrates that even as many other businesses were going out of business during the Great Recession, I'm sure you saw it in your communities, restaurants and strip malls and some banks, et cetera, the investment class that performed the very best was long-term care. So we have gone through this horrible time over the last 5 or 6 years, and we're still standing, and we have a lot of pressures that we still face, but the good news is that we're doing okay. The second piece of good news that I want to tell you about is that we also made it through some massive changes at the federal level as it relates to budget cuts. Because of the Great Recession, there was a lot of discussion at the federal level about balancing the budget in very dramatic ways, about reducing the deficit through significant tax increases or more possibly through major budget cuts. Now, some of the proposals that were out there would have cut other programs, but many of them would have cut our sector, skilled nursing, in such a dramatic way that we just would not have been able to make it. There were talks about completely eliminating provider assessments. There was discussion of completely eliminating bad debt reimbursement. There was talks about rebasing our Medicare rates and cutting us 4% and then going on from there. Well, the good news is that didn't happen. If you look at this chart, what you can see is that when we went through the last 4 years, Congress as a whole cut $2.7 trillion out of our national debt. Not just our money, but all of the money that's out there, $2.7 trillion. If they had done across the board cuts, our sector would have been cut $54 billion. $54 billion of that $2.7 trillion would have been on us. Well, through some hard work and through some good luck, we were able to reduce the amount of that impact to our sector so that our sector was cut $12 billion. Now, I don't want to minimize the impact of a $12 billion cut. What made up that $12 billion cut was the 2% sequester cut that we took a couple of years ago. But what I would say is that relative to how everyone else did, particularly the Defense Department, discretionary spending among other agencies, et cetera, we came out on a relatively better basis. We should have been cut $54 billion if they'd done across the board cut. Not that we should have been, but that's what an across the board cut would have done. Instead, we were cut $12 billion. So all in all, we've made it through sort of intact. Again, I don't want to overstate that things are incredibly great, but we've made it through a very tough time through both the recession and through federal budget cuts. Now I'd like to talk with you very briefly about a final point which Signatures had a lot to do with. And that is that, a lot of times when you're going through challenging times like we have been for the last 5 years, people fight, they don't get along, they divide, they peel off. In our sector, we did just the opposite. While other trade associations in DC were falling apart or splitting off or fighting with each other, we actually brought the sector together. There were two major organizations out there, the Alliance and the American Healthcare Association. We were able to bring them together. There were some very important operators that didn't have all of their buildings into the AHCA membership. We've been able to address that. And so the net result is that we're more unified than we've ever been before. I'm very proud of this chart, and again, thank Signature for the role that it's played in it, which shows our membership at the national level over the last 5 years. Really starting about 4 years ago, in January of 2011, we've been on a pretty steady march to significantly increase our membership so that as we sit here today, we now represent over 1 million of the nursing home beds in the United States. And when you consider that there's probably only about 1.4 million out there, we're making great progress at pulling people together. Now, more important than just getting larger is I think we're getting better. We're using the funds from our members to, in a very smart and strategic way, lobby on Capitol Hill, create policies that are real solutions for the policymakers. So we're not only strong and unified, I think we're spending our resources in a good way. So that's the good news. Let me talk now very briefly at quite a high level about some challenges that we still face. And I want to address several of these challenges that are out there. The first is that we continue to face oddly enough, a demographic challenge that many people are not aware of. Now, I know that when we talk about one of the reasons that we're in such a great sector is that there's a growing population of older people. That's generally true. The older population is growing quite significantly. But as all of you know, the population that really matters to us is a population that's quite a bit older. And that is folks that are over 85 on the long stay basis. Because the average age in our buildings, at least the buildings that Stacy and I operated, was in the 83 range. And again, that's on a long stay basis. And I suspect that you have a similar experience in your buildings. There's an interesting phenomena that many people don't know about that this chart depicts. And that is that if you look at the gray line on this chart, it is showing the population growth of people that are over 85 years old. Again, it's population growth of people that are over 85. Oddly enough, between 2015 and 2020, you will see that line is actually on the decline. There's actually a decrease in the population growth of people over 85 from 2015 to 2020. Some of you may be experiencing vacancies in your long stay in your residence. There are multiple reasons for it, but this is one of the reasons. Now you might ask yourself, how could this possibly be the case? And the reason it's the case is an historical reason. After the Great Depression in 1929, the Great Depression really lasted from about 1929. It looked like the economy was getting better in the 30s, and then there was a dramatic recession that followed in 1937. So really between about 1929 and about 1938 or 1939, the country was in a terrible position. Immediately after the crash in 1929, a lot of people lost everything. And what happens in America when a lot of people are losing things? They stop having children. And so there was a significant decrease in the birth rate in the United States between 1929 and 1934. Now you might say, Mark, what does that have to do with my life right now? Well, the people that would have been born in 1930 would be turning 85 right now. And there are a bunch of them that just were never born because people cut back on the number of children that they were going to have. This overhang of the depression baby phenomena is something that we will have to deal with for the next 3 or 4 years. But then the good news is that if you look at that chart, you'll see that starting in about the year 2020, the rate of growth in the population over 85 grows, and it grows dramatically. The other good news is that if you look at the top line, that's the growth of population of people that are over 75, and it's growing right now. And the reason that's good news is because the average age of a person in our short stay buildings is only 78 years old. So we have the wind at our back as it relates to our short stay, but we've got this little trough in our long stay that we have to deal with right now. The second challenge that we have out there that I want to talk with you briefly about are the budget challenges that we face at the state and federal levels. Despite the fact that we've come through this enormous recession and we're still standing, the federal and state governments really haven't recovered. The state governments are starting to recover slowly from the budget problems that they had 3 or 4 years ago, some better than others. The federal government is still in a significant amount of debt, and what this chart shows is that that amount of debt will continue to increase in the future. What all of this means is that at the very time that we'll have more and more people that will need our services, there will be less money from the federal government in order to help us pay. So the question is, what do we do to seize the future? What do we do to make sure that the millions of acts of spirituality that are taking place all across the country, including in your buildings every day, what do we do to make sure that those can continue? Let's talk now about how we win and actually seize the future. The third challenge that we face are changing payment models. It, in fact, in my opinion, is the greatest challenge that we faced. And I'm talking here specifically about the way that we're paid for doing rehab on a post-acute basis. The rehab that we do that is getting so many people well and back to home. Unfortunately, in real time, right now, the way that we're getting paid is changing all over the country, in almost every market, and this can create some real challenges. Now, I will tell you, though, that it can also create some real opportunities, and I'll talk about that in just a little bit. But to give you kind of some history on this change that's taking place, this chart depicts the way that we were paid back in 2009. 75% of the folks that we took care of, did rehab on, and got home, we were paid through Medicare Part A, the traditional fee-for-service model, where we decide what rug category somebody belongs in, we decide how much therapy to provide them, we get them well, and we get paid on a day-to-day basis. About 25% of our payments was through managed care, where somebody had sold their Medicare benefit and were paid by a managed care company. All the way over the last 5 years, there's been some significant changes. So if you get up to 2014, you can see that now all of a sudden there's not just fee-for-service, which is in the blue, or Medicare Advantage, which is in the black. In addition to that, there are now accountable care organizations and in some state dual demonstration programs. We've had modeled out what will this look like in 5 years from now. In 5 years from now, the change will even be more dramatic, with less traditional fee-for-service, more managed care, probably more ACOs, probably more duals. The truth is nobody really knows exactly what payment model is going to take hold, but what everyone agrees is that traditional fee-for-service will decline. Now this can be a problem. And the reason it can be a problem is that in all of these other payment models except fee-for-service, the payers are requiring us to dramatically reduce our length of stay. So if you look at a traditional fee-for-service model, you'll see that we've been taking care of people for an average of 28 days. That's across the country. Your average is probably around that. In these other models that are out there, whether it's Medicare Advantage or ACOs, folks are saying, we're not going to include you in our network unless you discharge folks a lot sooner than that. Now, this is not only bad for us, more important, we think it's not good for the residents because they're not getting all the therapy that they need. But it's not hard to envision what a challenge this is for Signature and the whole sector. Even though there are more people getting older and more people that will need our services, if our length of stay is cut in half, our overall admissions may grow, but our occupancy will decline because the people will be in our buildings for just such a very short period of time. So there are challenges out there. We do have this little demographic issue on the long stay side. The state and federal governments are challenged with money. And we do have this issue out there with changing payment models. But I will tell you that there is a path to win. And so during this next part of the speech, I'm going to talk about what it is that Signature needs to do and what the entire sector needs to do in order to prevail. Let me start out by saying that I'm completely convinced that Signature can win. On a company-by-company basis, I believe that you will be able to make the changes and progressions forward that you need to not only survive, but to do really well. And I'm going to talk about that in just in a second. I think the bigger question is, can the whole sector, can all of the buildings that are out there now, not just the Signature buildings, but all the other buildings out there, can a number of them survive and prosper as well? And I think the answer is yes. One thing that gives me comfort is the realization that in our sector, we have had to adapt before. We have had models in the past that made sense at the time, but as society and healthcare progressed, they didn't make sense anymore. And yet we figured out a way to adapt. We started out as poorhouses back in the early 1900s, then county homes, then they called us rest homes. We developed into long stay nursing homes. And now we've become very sophisticated rehab centers that actually take care of more people that we send home than people in long stay. So I am convinced that we have the ability to adapt because we've adapted in the past. Now, in order to win, our belief at the AHCA NCAL is that we have to do two things. First, we have to be the policy and the quality solution, which means at AHCA that we're developing policies for CMS and policy for members of Congress up on the Hill, so they don't just do crazy things to us, but instead we give them rational alternatives and rational payment models for us. Unfortunately, in DC, just having great policy, though, isn't enough. We also have to be very strong on the political and lobbying side. So we've taken the resources that you and other members have given us, and we've hired a top-notch group of lobbyists on the internal team that actually work at AHCA, and also outside consultants that we use, and we have them descend upon Capitol Hill and lobby for us. Now, I'm very encouraged by the results that we've had over the last 4 years, but obviously cautious about what might be coming up over the next 4. What we tell folks when we lobby them is that we believe that the data indicates that we are the solution to the problems that they face. That we have the ability to not only take care of people in a great way, but we can take care of them in a way that saves the government money because we get them well and we get them home. What I'd like to do now is to show you a short video that we're currently showing to policymakers as we go up on the Hill that we think really explains the fantastic work that you're doing in your buildings every day.
With over 3 million people receiving care every year, the American Healthcare Association exists to improve these lives and the lives of the 13,000 members that care for them.
We're your emissary here in Washington, and we're your face. We're an extension of you. And it is up to us to tell that story in a way that people can understand what it means to care for someone 24 hours a day.
It is not the sleepy little nursing home that it used to be. It is not the business that it used to be. We're taking care of a much higher acuity population, much sicker people that are coming out of the hospital.
When I came out of surgery, I had lost the ability to walk. But it came down to your next level of care. And since I've gotten here, I've made advancements. And a lot of the gains that I've made was being right here at rehabilitation.
We see the patients more than the doctors do. We see changes in the patients. And our job here is to be able to get people back to their normal lives, to their routine.
In a pursuit to enhance quality beyond the status quo, AHCA has laid out a bold plan. Keep hospital readmissions to an absolute minimum. Recruit, train, and retain caregiver professionals. Create a person-centered care environment. And reduce the use of unnecessary antipsychotic drugs.
It's clear that rehospitalization has a tremendous impact on our federal budget. So the good news is the skilled nursing community is motivated and incentivized now, and the degree to which we can lower rehospitalization rates is the degree to which not only the federal government can save money, but most importantly, the patient can improve and get better.
Last year, nearly 3 out of every 5 people who entered into one of our centers for rehab returned home, often within just a few weeks, and without having to go back into the hospital for costly and invasive procedures.
People are rehabilitated here, they go home. I'm home, I am working.
It's hard work, but at the end of the day, it's extremely rewarding.
The people here are outstanding. Going from the administrators, everybody speaks to you. Everybody has a smile.
I come every day to just change people's lives and make their life a little better, every day.
They're heroes. They're heroes here.
My job is to help people. My job is to make people's lives better. And you gotta love that.
We are the safety net. We can save money in our operational costs and ideally create a win-win for not only the provider, not only for the government, but most importantly the patient. And that's our philosophy, and every policy approach that we take, we see through that lens and that approach.
Join us on our website to learn more.
In addition to our lobbying and our lobbyists and political people and all that at AHCA, what I'm really proud of is I think we've become kind of a think tank in DC as well. We have a quality division, a reimbursement division, and a research division that is constantly coming up with ideas that work for our members and their residents. This last year we spent an awful lot of time on payment reform, where we have developed a model of payment in post-acute that puts us back in control of our residents. Signature's been involved in this, and it's part of what we lobby up on the Hill in an active way. The goal is to put us back in control. That's the work that we're doing at the national level. I think the more important question for today is what can Signature do in order for you to succeed in each of your buildings? And I think the answer is that despite the challenges that we face, these challenges for a company as innovative as Signature are actually a tremendous opportunity. If we look at this next chart, I think it will really explain the opportunity that's out there. In the old world of discharges from hospitals, hospitals would typically discharge to virtually every nursing home that was in its area that provided post-acute rehab. So in this first example of the old world, it envisions a hospital that has 4 skilled nursing centers around it, each of which that does post-acute rehab. If you look at the discharge patterns for that, hypothetically one building might be getting 40% of the work, another building might be getting 30, another 20, and another 10, but you have 4 different buildings out there that were getting discharges. The way that we would try to get discharges is we try to hire really perky and convincing marketing people who would run around and meet with the discharge planners from the hospitals and try to make sure that we were the facility that got that 40%. In the new world, in the change payment model world that we're seeing, discharge patterns are going to be based far more on the outcomes that facilities can provide than on the quality of their marketing people. I think marketing people and discharge planners will still matter, but what's way more important to hospitals and to systems will be, where can I send residents that I'm pretty sure they're going to get well and not get sent back to me and hurt me on my rehospitalization penalty? Where can I send people in a network that we've created that's being incentivized to get great results? So I think that in the new world, where you have a market with a hospital and 4 skilled providers, you're going to see something that's much more like this chart that talks about the new world, where there might just be 2 buildings that get residents at all, and they each get 50%, with the other 2 being completely shut out. In fact, I think there could even be markets where one provider gets all of the post-acute rehab and everyone else gets shut out. Now, this is a huge opportunity for a progressive provider like Signature, because you have the opportunity to not just be in that 40% or 30% bucket in the old world, but you have the possibility of really dominating a market if you can win in that market. So how do you do it? Well, the way that you do it is that you first of all understand who the payers are in your market. And this varies market to market. In some parts of the country, managed care has really taken hold. And it may be penetrating at a level of, say, 50%, which is quite high, because for the whole country, it's only 30%. In other parts of the country, it's not managed care organizations that have taken hold, it's accountable care organizations. In other parts of the country, it might be the dual demonstration projects. Whatever it is, you need to figure out on a market-by-market basis who is controlling the payments, and then you need to figure out what metrics matter to that payer. What is it that you need to be superb at in order to attract the discharges from that particular payer? In most markets right now, it is your rehospitalization rate. And that's because every hospital in the country faces a penalty if they don't do a great job on rehospitalization. In other parts of the country, it could be staff turnover. We see some accountable care organizations that are looking at 5-star ratings. We see others that are looking at staff turnover, resident satisfaction, et cetera. The key is figure out what it is that the metric matters to your payer and then get really fantastic at that metric. And then don't just send a discharge planner, don't just sit down with the discharge planner and a marketing person. Sit down with yourselves and some folks from your organizations, with the CEOs and the CFOs of the hospital or the managed care organization or of the accountable care organization, and say, look, we know that what you really care about is rehospitalization, and here's why we're better than anyone else. Now, I think that Signature has a unique advantage in this new payment model world. Now, best practices are a given. It's going to be a given that in order to be in any of these networks, you've got to have the best electronic medical records. You've got to have the best transition planning. You have to have the best clinicians, et cetera. Many of the people, not all, but many of the people that you'll be competing against will have those just as Signature will have them as well. So the question is, how do you distinguish yourself? What makes you different? A basic tenet in business is that if you can't distinguish yourself in some way, the only way that you're competing against a competitor is on price. So what is it that distinguishes Signature? And I would contend that it is your pillars. Your entrepreneurship, your learning, and your spirituality are something that honestly I haven't seen with any other provider across the country. To create passion around those three concepts, very important concepts of entrepreneurship, learning, and spirituality. An example is your Serenity program. And in discussing with Diane, she was explaining to me ways that your Serenity program will help with the use of antipsychotics by intervening and working with residents, treating them as people. You have an advantage. So again, I think a lot of companies out there will get the best practice stuff down. The unique advantage that you have are your pillars. The final thing that I want to talk about today before closing is I want to talk about 5-star. The changes to 5-star have just occurred, and I think it's important that I make a couple of comments about 5-star. If for no other reason, I want the folks in the audience whose buildings might have lost a QM star or maybe an overall star to not feel bad about it and to not get discouraged. And I really want to talk with you about what happened and what I think you can do to fix it if you're in that situation. Now, the history of 5-star itself is pretty interesting. It was really kind of thrust upon the sector in the last days of the Bush administration. I don't think it was President Bush. I think it was an administrator, a low-level political person who wanted to do this, and it was not fully vetted with the industry or I think with thought leaders. And so we ended up with a system that was really not very good. And there's nothing wrong with measuring this. That's fine, as long as the measurement is fair. And in this case, it wasn't. And to me, the most unfair feature was the part that said that there was a curve and only 10% of us could be 5-star and 20% of us had to be 1-star, no matter how good we all got. And that created, to me, just an inherent level of unfairness. We challenged that, and we had a pretty significant win in 2012. Because in 2012, what CMS did was it broke the curve. Now, it kept the curve for the survey component of 5-star, but it broke the curve for staffing and for quality measures. It created a situation where it created cut points and allowed all of us, if we got good enough, to become 4 or 5-star on quality measures and on staffing. And the reason that's important is because if you become a 5-star on quality measures, it adds 1 star to your overall score. So what happened? Well, what happened is we got better. In fact, we got a lot better. We went from just having 10% of us as 5-star on the quality measures to over 40% of us being 5-star on the quality measures. And that resulted in a dramatic increase in 5-star ratings across the country. Now, that's good news, right? Skilled nursing centers are getting better. Well, you would think so. And it would be good news, I think, in every city in the country, but somehow in Washington, D.C., this was considered to be not good news, that somehow we were gaming the system or making up data or something like that, and so this had to be significantly addressed. So we were working along with CMS on addressing it, and we thought that there was going to be a rational solution, and then some intervening things occurred. Now, this chart shows the significant progress that we made on the QM scales. Again, if you look all the way to the left side, you'll see that only 10% of us were 5-star on QMs back in 2009, but that grew dramatically so that by last summer, over 40% of us were 5-star on QMs, and almost 70% of us were 4 and 5-star. Again, CMS said when we broke the curve, look, we're going to have to go back and look at these cut points at some point in the future, but we're going to let, for a while, all of you try to get better and grow your QM scores. And that's what we did. As we were progressing towards, I think, what would have been a more rational solution to this whole thing that would have been released probably this summer, the major intervening factor that occurred was that there was a New York Times expose that claimed that our providers were making up data to juice up their QM scores and their staffing scores. And so the president issued an executive order that said, we got to rebase this significantly. We need to add 3 other measures, antipsychotics and some other things, and redo the whole thing, and it all has to be done by January 1. That announcement was made in October. Well, we got our policy, research, and quality team on top of this immediately, and within 72 hours, we had a turnkey solution for CMS. And we met with folks at the top level at CMS, and we said, our solution is that we keep people at their current star ratings, but in order to keep them, you demand progressive improvement in the future. Well, what CMS said was, well, we can't do that. We can't have a system where almost 70% of the people start out at 4 and 5-star on QMs. On top of that, we had our critics out there banging on CMS to do something very dramatic. They were banging on CMS to take us back to the point in time where only 10% of us were 5-star, and that there was no curve. I'm sorry, that there was a strong curve. So they were going back to, I'll start back. Let me fix that. Our critics wanted CMS to go back to the old system. Only 10% of us 5-star and a strong curve so that all of us couldn't get better. Our board took a very strong position. Our board said, no, we're not going to support that. First of all, they cannot go back to a curve. Secondly, there needs to be some way that all of us can get better and grow our 4 and 5 stars. And finally, the solution needs to keep as many facilities protected as possible. CMS gave us a partial victory. They did not take the recalibration all the way back to 2009, where only 10% would have been 5-star. Instead, they took it back to a point in time of around 2012, where roughly 25% of us were 5-star on the QMs. So it could have been worse, still not great, 25% as opposed to 40%. Most important, they did not reimpose the curve, so that all of us now have the ability to go back and regain stars if we lost them. We have the ability to go back and become 4 and 5-star building. So that is one slight positive. If you lost a star, the first thing I want you to know is that you are not alone. This chart demonstrates that over 4,000 buildings in the country lost a star. And that's because so many people had their QM rating drop because of the recalibration that CMS performed. Now, if they'd done what our critics would have wanted them to do, we would have had, I think, over 7,000 buildings lose star. Thank goodness they didn't do that. But you're not alone. The other thing, and I know that you know this, nothing changed in your building. And that's what's so frustrating about this. In fact, in all probability, your buildings have been improving on all the QMs over the last 3 or 4 years. And so I know to lose a star overnight has to be horribly frustrating, because not only is it discouraging, it sends the wrong message to your residents and their families. You're not getting worse. We know that. You're getting better. CMS just made the decision to recalibrate the scale. So, what can you do? Well, we've got some resources to help you at AHCA. The first is that if you go to our website, there is a web page that's devoted to this and has a lot of things on there that we hope might be of some help. If you've lost a star, there is a template letter there for you to utilize for family members and to residents that explain that, hey, nothing has changed in the building. This has simply been a recalibration. The other thing that we've done is we've invested a significant amount of money over the last few weeks in updating long-term care trend tracker to reflect the changes that CMS has made. If you're using long-term care trend tracker, you know that you can use that to benchmark yourselves against other buildings to see how you're doing compared to the other people in your market on length of stay, on census, on deficiencies, a whole bunch of different things. A very cool feature in long-term care trend tracker is that you can also go in and take a look at the CMS measures, the quality measures, and manipulate them to see what you'd have to do in order to increase a star. So we've just spent a bunch of money with our software maker. We hope to roll out next week, the second or third week in March, this new feature on long-term care trend tracker where you'll be able to go in and figure out exactly what you have to do in each QM measurement in order to increase a star level for the QMs. And of course, if you can get your QM level up to a 5-star, it'll show you therefore what you need to do to increase your overall star rating by 1 star. Conversely, if you're a 1-star, and I'm sure there aren't very many Signature buildings that are 1-star on QMs, but there may be some, and it's not any shame. Again, they've just recalibrated this. You need to very quickly get out of that 1-star area because that's costing you a star on your overall score. And again, you can manipulate the QMs in long-term care trend tracker and figure out how to do it. I guess my most important message to you on the 5-star would be this. We know how hard you're working. We know how much you care about your residents and their families, and we know you're getting better. Don't let them get you so discouraged that you give up or you get frustrated. Let's figure out a way to once again conquer this system and get better and have a star rating reflection that really reflects the great work that I know is going on in your buildings. I'm going to close today with just a couple of comments. First, I want to tell you that I strongly believe that there is a path to success. That despite the incredible challenges that we face every day in our buildings and at a macro level in DC and in our state capitals with funding and plaintiffs' lawyers and the press and critics and all that, there is a path to success. There really is. And that path is to continue to provide great work in our buildings, to be the low-cost provider, to be of high quality, to make sure that we're responding to the metrics that our payers care about. If you do that in your buildings, you're going to succeed. I strongly feel that way. It gets a little harder when you get outside of Signature and a company that's so passionate about all these things. We still have some folks out there that don't quite get it, don't understand the importance of quality and all that. But at the level of a company like Signature, I am 100% confident that you can succeed. The second thing is that I want to again emphasize to you how much I appreciate the daily acts of spirituality that are occurring in your buildings. It's the reason that I do this work. The fact that Stacy and I were in our buildings for 10 years, so we know what's really happening there. We know the love, the compassion, the selflessness that's taking place every minute of every day, of every year, forever. It is incredible, and I can't thank you enough for it. I saw a film a couple of years ago called What Is That? It's a short little film. It's called What Is That? And it touched me pretty significantly. It's an interesting film about a man who has dementia and his son, and the son becomes increasingly agitated in trying to deal with his father's dementia. It's something that we see in our buildings all of the time. It has a beautiful ending though, where the son is sort of forced to recognize that he needs to deal with his dad, not as an object or as an inconvenience, but as a loving dad, as a person. Anyway, it touched me very deeply. I've actually only shown this video once, and it was at a live speech, and I can't ever do that because I'm an emotional person, and I showed the speech, I showed this video, and I knew it would affect me emotionally. So the whole time the video was up, I'm like, okay, I'm not going to tear up, I'm not going to tear up. And I looked out in the audience, and there were people in the audience that were crying, and that caused me to kind of lose it. So I haven't ever done it since then. So I'm actually not going to speak after this film starts getting shown, because you don't want to see your big-time Washington, D.C. CEO, break down in front of you on camera. We're not going to do that. But again, thank you very much for the opportunity to spend some time with you. Thank you for everything that you do. And I hope that, at least for some of you, this film touches your heart. Thank you all very much.